Your doctor has recommended that you receive a permanent pacemaker implanted in your body. But what does that actually mean? The heart is located in the center of the chest, enclosed by the breastbone and rib cage. By contracting in a rhythmic way, it causes the blood in your body to circulate. A normally functioning heart beats at a rate of between 60 and 100 contractions per minute. These contractions are triggered by a small piece of heart tissue called the SA node. The SA node generates a small electrical signal that is transmitted by nerves to the surrounding muscle. These electrical impulses are what cause the heart muscle to contract. In some people, the SA node fails to cause the heart to contract with its normal rhythm, causing an abnormal heartbeat or arrhythmia. The most common form of arrhythmia for which pacemaker surgery is often recommended is bradyarrhythmia, or slow heart rate. There are a number of reasons why you may have developed an arrhythmia, but in most cases, the problem is caused by a disruption in the SA node, or in the system of nerves that conduct electrical signals to the heart muscle. A pacemaker is a device that is designed to provide an electrical signal to the heart muscle and to help it maintain a proper rhythm. There are several types of pacemakers, and the particular model selected for you will be based on your specific condition. But all pacemakers share a common design. Your pacemaker will consist of two major pieces: a small metal box that contains a battery and other electronic components, and an insulated wire called a lead, which will carry the electrical impulses from the pacemaker to the heart. Your pacemaker will be permanently implanted in your chest, and depending on your condition, either one or two leads will be attached to the heart muscle. Then, the surgeon will make a small skin incision in the upper chest, just below the collarbone. A pocket is then created between the skin and the tissue that covers the chest muscle. Next, the team will use instruments called retractors to hold back the skin and underlying tissue. They'll locate a large blood vessel called the subclavian vein. Using a special needle and syringe, your doctor will puncture the wall of the vein. A thin guide wire is then inserted through the needle and into the vein. Your doctor gently pushes the wire until it reaches the heart. Using an instrument called a fluoroscope, the surgical team is able to see the wire's progress through the vein and into the beating heart. Once the wire is in place, the needle is removed and a catheter, or hollow tube, is passed over the guide wire and into the heart. One or two leads are then passed through the catheter. When the lead or leads are in their proper position, the catheter is removed. Finally, the lead is connected to the pacemaker. The pacemaker is inserted into the pocket below the collarbone, and the incision is closed.
Now let's talk about what may occur after surgery, some risks of surgery, and what you can do to help. It is important for you to speak up and tell your care team if you have more than expected pain or problems. They will be watching for early, rare complications. If you have general anesthesia, you may feel awake quickly. However, these medications can impair your thinking for several hours. Some patients notice effects for days. If your surgery is done as an outpatient, you will need a ride home. Plan to rest. Do not drive, operate machinery, make important decisions, or drink alcohol until the next day. You may be told to restrict your activity for 24 hours. Be sure you understand your personal instructions. If you are admitted to the hospital after surgery, your length of stay will depend on the specific procedures that were performed, any new findings or unexpected outcomes, and your other medical conditions. Before your surgery, know what is planned for you so that you can prepare. Results and immediate findings of the procedure may be provided the same day. However, if tissue was sent for testing, the biopsy results may not be available until a later date. Be certain you understand the outcome of your procedure and if or when you need to follow up with your surgeon. For the best recovery, follow your instructions after surgery that may include information about the safe use of medications, the timing of return to normal activity including walking, steps, driving, and showering, incision care to keep it clean and dry, and extra rest as needed to heal from surgery and recover from anesthesia. Any procedure will make you more tired than you anticipate. Depending on your procedure, you may or may not require narcotic opioid pain medication. Narcotic opioid pain medication is most effective the first 1 to 2 days. After that, narcotic medication worsens constipation and has other side effects. For this reason, you may receive a limited number of tablets with your prescription. Use all medication with care and only as instructed by your surgeon. You can help your body heal. Eat healthy foods. Avoid junk food, sugary drinks, and don't smoke. Smoking and high blood sugar slow healing. If you are instructed to use a heating pad or ice packs after surgery, each must be used carefully and as instructed to avoid accidental injury. Always place a towel first against the skin. Never sleep on or with a heating pad. All surgery has some risk of complication, including unexpected injury, bleeding, and infection. A blood clot or DVT can form in the legs or pelvis during or after any surgery. It can cause a lung complication called a PE or pulmonary embolism. Steps are taken by your care team to help avoid this complication. Your personal risk of complication relates to your overall health, the complexity of the surgery, and the experience of your surgeon. Call your doctor if you have trouble with diarrhea, vomiting, or worsening constipation. Call if you cannot urinate, have a fever or pain that is getting worse even with rest and medication. Call 911 if you have chest pain, shortness of breath, dizziness, bleeding that doesn't stop, and any other sign that you may be having a complication from the procedure. Hospital admission, medication, or surgery may be needed to correct some problems. Now let's talk about your responsibility and how you can help the day of surgery. To avoid cancellation or complications from anesthesia or your procedure, your job as the patient is to not eat, drink, or chew gum after midnight, the night before the procedure, unless you are given different instructions. Take only medications you were told to on the morning of the procedure with a sip of water. Follow instructions regarding aspirin and blood thinners before surgery, and arrive on time. You should be ready to verify or confirm your list of medical problems and surgeries, all of your medications, including vitamins and supplements, your current smoking, alcohol, and drug use, and all allergies, especially to medications, latex, and tape. All surgery and anesthesia have a small but possible risk of serious injury, even some problems very rarely leading to death. It is your job to speak up and ask your surgeon if you still have questions about why this surgery is being recommended for you, the risks and alternatives. This video is intended as a tool to help you better understand the procedure that you are scheduled to have or are considering. It is not intended to replace any discussion, decision-making, or advice of your physician.